Assalamu alaikum. Cartilage growth therapy. As you know, the cartilage damage occur or happen by several methods. Not you are going not to mention it about it. You mention about cartilage growth therapy. Autologous chondrocyte implantation involves taking healthy cartilage cells from an undamaged area of joint, culturing them in the lab, and then implanting back in this damaged area. Stem therapy, injecting stem cells into this damaged area to simulate cartilage repair. Stem cells are immature cells that have the potential to develop into different types of cells, including cartilage cells. Gene therapy, introducing gene into cells is damaged joint to promote cartilage repair. Obesity and the cartilage damage. Obesity causing mechanical stress and metabolic inflammation, leading to accelerated cartilage damage and severe osteoarthritis. Tackling obesity through weight reduction could mitigate these adverse effects that cause osteoarthritis. Effect of fasting. Weight loss, which lessens mechanical load of the joint, possibly contributing to pain reduction in patient. Fasting has shown improved liver metabolism, which is associated with disease severity. Regrowing of cartilage. Slight injury to the joint tissue and using chemical signals to steer the growth of skeletal cells, stem cells, as the injury heals. Shows potential for regenerating cartilage, which typically has minimal regeneration potential in adulthood. Autophagy and the cartilage damage. An essential cellular homeostasis mechanism has been observed to play a role in restoring function of damaged chondrocytes. Fasting and the stem cell. The metabolic switch from glucose to fatty acid deriving ketone, which serve to preserve muscle mass and function, triggering stem cells to become more active and regenerative. Prolonged fasting has been associated with enhancing regenerative capacity of stem cells. Fasting may play a role by indirect role in promoting cartilage health by reducing inflammation and oxidative stress. Inflammation is a major contribution to cartilage damage, and oxidative stress can damage cartilage cells. Fasting may help reducing inflammation and oxidative stress by lowering blood sugar and reducing production of inflammatory molecules. Fasting also may have weight loss, improved insulin sensitivity, cellular repair process like autophagy. Cartilage growth therapy involves physical therapy, exercise, and sometimes surgical intervention like cartilage grafting or stem cell therapy. Fasting indirectly supports cartilage health by promoting overall wellness, reducing inflammation, potential enhancing cellular repair mechanism. Intermittent fasting in particular may have anti-inflammatory effect and could promote tissue regeneration. Intermittent or Islamic fasting for cartilage growth. Intermittent fasting, cycling between period of eating and the fast, which to eat, when to eat, improve insulin sensitivity with loss and cellular repair mechanism like autophagy, reducing inflammation and promoting overall wellness. Islamic fasting, fast from dawn to sunset, abstaining from food, drink, smoking, and sexual activity. As you know, we going through method of promoting cartilage growth, which is more recent and more old-fashioned methods. You may or may not found this method, or we may not have the financial support to go through this. The simplest one is Islamic fasting, which is free. Less effective is, or second effective is intermittent fasting. These two methods should be considered as a part of treatment and not alternative. Only alternative if there is no ability. Assalamu alaikum wa rahmatullahi wa barakatuh. Don't forget to participate in this channel and press the bell.